So guys, let's get on with bleeding disorders. Bleeding disorders are conditions that leads to abnormal excessive bleeding, and this abnormal excessive bleeding is essentially because of disorders related to platelets or thrombus formation. So at the outset, bleeding disorders are essentially disorders of, number one, it is disorders of platelets, or number two, they belong to disorders of thrombus formation. Coming under this heading, bleeding disorders, let us start our discussion with disorders of platelets. So what are all platelet disorder? People, when it comes to platelet disorders, first thing and foremost thing you should be familiar with is going to be thrombocytopenia. Alright, thrombocytopenia, where there is going to be a drop in platelet numbers. For some reasons, there is going to be decrease in platelet numbers. When it comes to decrease in platelet numbers, there are multiple conditions that brings down to thrombocytopenia. So the first and foremost condition that you should be familiar with thrombocytopenia is going to be dengue fever. It's going to be dengue fever, where there is going to be decreased platelet synthesis and there is going to be increased platelet destructions as well. Alright, so thrombocytopenia is due to decreased platelet synthesis as well as increased platelet destruction. Now apart from this, a very important disorder that you should be familiar with is going to be called as purpura, guys, and it's a very important disorder, not in terms of its clinical significance, but purpura is the word which has been emphasized in your CBME curriculum, guys. So you must have a solid understanding of purpura. At the outset, let's get to know what is purpura, people. Now purpura is nothing but a disorder which is manifested by very small bleeding, very small bleeding, and this bleeding is seen in skin, this bleeding is seen in tissues, this bleeding is seen in joints and sometimes into gastrointestinal tract as well. So if the magnitude of bleeding is very small and this bleeding is seen in skin, mucous membrane, tissues, joint spaces, GIT, we call this condition as purpura. Now this small bleeding is made possible because of extravasation of blood out of blood vessel. I repeat, there is one pathophysiology that leads to purpura, and that is going to be extravasation of blood out of blood vessel, guys. So let's take up this blood vessel and let's consider plasma is flowing in this blood vessel, guys. Let this be plasma or let this be blood. Now because of some conditions, you are going to see very gentle extravasation of blood out of this blood vessel. Alright doctors, so there is going to be plasma which is getting extravasated out of this blood vessel. When plasma comes out of this blood vessel, it gets accumulated under the skin, under the tissue, and if you see under the skin, consider this as a skin, and this accumulation of plasma under the skin is going to appear as hemorrhagic spots, and these hemorrhagic spots are going to be called as purpura, also called as purpuric hemorrhages. So at the outset, this is what is called as purpura, guys, where the presentation is smaller bleeding dots beneath the skin or into the tissues or into the joint space or into GIT. This is purpura, guys.